measles cases in Kansas have now risen to 23. State health officials say that the outbreak there could be linked to the one ongoing in Texas, New Mexico, and Oklahoma that's infected at least 379 people. In both cases, unvaccinated children represent a majority of the cases. Now, this comes after comments by HHS Secretary Robert F. Kennedy Jr. in an interview this month. He's previously and wrongly linked the MMR vaccine to autism. In the interview, while he did say that the vaccines, quote, do prevent infection, he also downplayed their safety and said of their effectiveness, quote, for many people it wanes. There's no evidence it wanes in most cases. Then yesterday, Kevin Griffiths, the now former director of communications office at the CDC, published a new editorial in the Washington Post about why he left the agency the previous week. At one point, he wrote, Kennedy has promoted unproven treatments for measles. He also suggested distributing vitamin A, which does not prevent measles. Meanwhile, in my final weeks at the CDC, I watched as career infectious disease experts were tasked with spending precious hours searching medical literature in vain for data to support Kennedy's preferred treatments. I'm joined by Kevin Griffiths for this exclusive interview. Kevin, I appreciate you being with us. I do want to play some of what Secretary Kennedy said on to Sean Hannity that you referenced.
There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information and encourage them to vaccinate. The vaccine does stop the spread of the disease. Yeah, we're providing vitamin A.
Well, he mentioned that. Yeah.
Which, there are many studies, some showing 87% of effectiveness of vitamin A
to help, but
against serious disease and death.
I mean, there's a whole host of issues with what he said, as we just talked about. Why did you decide to leave your role at CDC? What was it about that interview in particular?
Well, I mean, one of the fundamental things, actually, that Secretary Kennedy talked about there, which was that it's important for us to provide the best information to the American people. The problem is that's not Secretary Kennedy's strong suit. And so, a couple of different things that played into my decision to leave CDC. One, public health communications overall has really ground to almost a halt. It's certainly just a trickle compared to what it used to be. I mean, that's important because medical information changes all the time. And there's essentially a pipeline, a circuit of information that's happening all the time that goes from the federal government, state, local governments, all the way down to your medical provider. So having a halt of communication could have an impact on your
Why
your
are
health.
they not giving press conferences? Why are they not communicating?
Well, I think that's something that you would need to ask them. But I think one of the things that's clear is that the communications process, the public health works best when the folks who are experts are the ones who are saying, hey, this is something we need to communicate, and we need to communicate it now, and not relying on political appointees to make that decision.
We mentioned that in your op-ed you wrote about career infectious disease experts spending hours searching for data to try to support Kennedy's preferred measles treatment. You went on to say all this misdirection is a waste of federal dollars that will do nothing to control the outbreak. It could also cost lives. Do you think the country is prepared for this growing measles outbreak or another pandemic?
Well, what I know is that right now that the leadership at HHS isn't doing what it needs to do do everything it can to control this problem. It is a complicated situation, and it's important that we spend all of our time thinking about what are the best ways to be able to interdict the situation and curb the outbreak. But instead of talking to the experts at CDC, Secretary Kennedy is talking to people on the ground who are I would say, of questionable reputations. And it's important that the folks at HHS, all political appointees, are listening to career officials who are experts to be able to just get the best advice so that they can make the best decisions.
The CDC is also bracing for cuts. I mean, it could affect, we're told, as much as a third of the workforce. What kind of an impact would a third of cuts have?
Right. Well, I mean, I think that it's going to have an impact on its CDC's capabilities. I think you can kind of think of it the way that you think about the military. In peacetime, there may not be a huge amount for the agency to do, but you're constantly preparing for what is next. And so what you want to be sure of is that you have the best capabilities, the best force ready to go when something, a situation escalates and you're needed. And if we have significant cuts to CDC, obviously that imperils that.
Kevin Griffiths, I appreciate your time tonight. Thank you very much.
Thank you so much for having me, Anderson.
Well, this news just into CNN. The U.S. Department of Health and Human Services, that's the health department effectively is expected to fire 10,000 people in a major overhaul of health agencies. The department saying that it is restructuring in accordance with Elon Musk's DOGE initiative. It says the cuts will save $1.8 billion a year. Combined with previous cuts, the downsizing will reduce about 20,000 employees across federal health agencies. Well, nearly 24 new measles cases in Kansas could be linked to outbreaks in 3 other states, health officials say. The measles outbreak in Texas, New Mexico and Oklahoma has infected 379 people so far. Physicians there also say that they are seeing patients with vitamin A toxicity. Now, they believe that is because US Health Secretary Robert F. Kennedy Jr. once suggested mega doses of vitamin A to ward off measles. Well, health experts say only the vaccine can do that. Our Anderson Cooper spoke with a former CDC official who recently resigned from the organization. He says leadership at the US Health Department is not doing what it needs to do amid this measles outbreak. Have a listen.
Career infectious disease expert spending hours searching for data to try to support Kennedy's preferred measles treatment. You went on to say all this misdirection is a waste of federal dollars that will do nothing to control the outbreak. It could also cost lives. Do you think the country is prepared for this growing measles outbreak or another pandemic?
Well, what I know is that right now that the leadership at HHS isn't doing what it needs to do to do everything it can to control this problem. It is a complicated situation, and it's important that we spend all of our time thinking about what are the best ways to be able to interdict the situation and curb the outbreak.
Well, senior medical correspondent Meg Tyrrell, joins me now live. Hello, Meg. Good to have you. How quickly are these cases growing? And are doctors particularly worried about this toxicity issue? Just explain.
Yeah, they're extremely worried about it. The cases are growing especially fast in Texas, really where the epicenter of this measles outbreak is. So now it's up to 327 in Texas. But of course, we know that cases have spread to nearby New Mexico, where there are 43 cases, and also to Oklahoma, which is reporting 9 cases. And most recently now, Kansas is saying the 23 cases it's identified there are most likely or probably linked to this same outbreak. So this outbreak has now grown potentially to 4 states. Separately, we also learned yesterday that there is an outbreak of measles in Ohio of 10 cases. They said that the first case had contact with someone who'd traveled internationally. And so it sounds like that's its own independent outbreak, Becky. And what's really concerning about this is you mentioned vitamin A. And this ties into what doctors are really worried about around misinformation around measles being spread by the highest echelons of the U.S. government, Robert F. Kennedy Jr., the health secretary, who has said that vitamin A is a good thing to use for measles and has even suggested it could be used preventively. And doctors say that's very dangerous. The only thing that works to prevent measles is the vaccine. And what we're seeing is vaccination rates dropping in a lot of these places. So that allows measles to spread. And really concerningly, the idea that folks should be using vitamin A on their own without the supervision of doctors. Vitamin A can be used for severe measles cases, but under doctor supervision. But we have heard from Covenant Children's Hospital in Lubbock, Texas, near the outbreak's epicenter, that several patients have been found to have abnormal liver function on routine lab tests, which is a probable sign they've taken too much vitamin A, Becky. So it's concerning all around.
Absolutely. And these cuts that we have just been reporting on at the Department of Health and Human Services, this can't be good timing with this outbreak going on. That doesn't matter, though, with Trump's focus on government cuts, of course. They will, it seems, continue.
They will, and specifically to the CDC, which of course oversees outbreak response. We're just learning this morning its workforce will be cut by 2,400 employees. They say they're working on focusing on returning its core mission to preparing for and responding to epidemics and outbreaks. But of course, that's a huge number of people who work at the CDC. That's on top of 3,500 cuts at the FDA, 1,200 at the NIH, and 300 at CMS. Importantly, they say CMS is the Centers for Medicare and Medicaid Services, and they say those shouldn't be affected by the reorganization. And at FDA, they say the reduction won't affect drug, medical device, or food reviewers or inspectors, Becky. But this is a massive reduction. 10,000 employees being fired afresh, and that's on top of 10,000 who've already taken voluntary retirement or buyouts, or that fork in the road thing. So that's a quarter of the health department's employees being eliminated here.